to the 130th session of the Weekly Huddle. I'm your host Anoop, and joining me today is my friend and co-host Praneeth. We both are cardiologists working at KIMS Hospital. As most of you know, the usual protocol or the usual format of the huddle, which is an unscripted audience level interaction where we address common clinical scenarios that we encounter in our daily clinical practice. If you look back at most of the sessions that have been discussed so far, most of them are around a particular clinical case. There are times where we have taken a few topics into account, like a few sessions back, we talked about COVID pandemic. But for most part, our format revolves around a particular clinical case. And we try to engage in a discussion just like what we do on a casual hallway, with the idea that we help a physician translate what is established knowledge to what will be a common clinical practice, taking all the local factors into account. Once a while, we do talk about general topic like what we are trying to do today. The idea or the premise of choosing today's topic is number one, to kind of add a little bit of variety in what we discuss. So rather than sticking to a case-based discussion, sometimes we can talk about these particular phenomena, which are directly applicable in our day-to-day life, in our patient interactions, and also interactions with our friends and family. The other purpose why this topic is brought up is because this particular statement by World Health Organization has been picked up by almost all major news outlet and social media. And I'm pretty sure that for all of us as practicing healthcare providers, we cannot escape this question. And I'm sure that at some point or the other, either our patient or our family member or somebody is going to ask this question and also give our and also seek our input regarding it. I'm talking about alcohol consumption, which you got in the invitation. And it is needless to say that it is probably one of the most commonly used or consumed psychoactive drug, which is consumed worldwide. I think there is a significant history behind it. I am not an expert at it, but I can say almost with certainty that the history goes back to ages and ages across all the cultures. What we also know that alcohol serves a lot of purpose in society, but at the same time, it being a psychoactive agent, it does have its own issues. I'm sure all of us at least have seen or encountered patients who have been, or people whose life has been significantly disturbed by alcohol consumption, either in the form of liver disease or changes in the social structure or accidents or whatnot. But I will put the premise of why this discussion came through. So in early January 2023, which is just about 10 to 12 days back, there was a paper published in Lancet with the title Health and Cancer Risk Associated with Low Levels of Alcohol Consumption. And it was a multi-author paper. And all the authors which were named in this paper, it's a consensus statement, not a research. And all the authors, they hold an active position in the World Health Organization. And simultaneously, the page was updated on the World Health Organization webpage also with the title that no level of alcohol consumption is safe for our health. This actually, to a certain degree, was a rebuttal of a group which is Global Burden of Disease, or GBD. And they actually published a study. The study was done in 2020 or completed in 2020, but the data was published last year, where they retrospectively analyzed. And as all of you know, that doing a prospective randomized study on alcohol consumption is just not possible for social reasons. But this particular study, when they looked at the region-specific alcohol consumption, they kind of attributed, or they kind of collected data about the overall alcohol consumption pattern with the aim of defining what would be a so-called acceptable safe limit for particular regions and particular age. So their idea was that one scheme cannot fit everybody, and that we need to have different thresholds for different age individuals for different regions. And that was the overall advocacy. The idea was not to promote low-level alcohol amongst these people, but the idea here was that we can safely define a threshold beyond which medically we can say that consuming alcohol is bad. And WHO quoted this study, and they went forward saying that there is no level of alcohol which is safe. We should actually get out of this mindset. Every single drop of alcohol which goes into the body, regardless of what is the preparation, is detrimental. And to my surprise, they labeled it as category 1 carcinogen, which places it in the group with radiation, with asbestos, with smoking or tobacco and whatnot. So with that, that's quite a strict statement as to speak. And for good reasons, all of this has been caught up by media houses, because it kind of affects almost everybody globally. Even if you don't drink, I'm sure you know somebody whom you love who drinks, and this is a discussion worth having. So, because it is not going to be a purely scientific discussion, because as I said, there won't be a randomized data behind it, and population-based data, particularly of this size, you can talk it either ways. There will be so many confounders, there will be so many limitations in the study, and this is the reason why, even with almost 100 years of modern medicine, or I would say 80 years of modern medicine, we still don't have good, high quality data about alcohol. So a lot of what we are going to discuss today will be our own thought process, our own rebuttals about what we think. And just so that I can keep the discussion going, for rest of the discussion, I will be talking in favor of low-level alcohol consumption. And just a disclaimer before we proceed further, the discussion today that we are having is not on alcohol consumption. I think we all categorically understand that alcohol consumption is bad. What we are talking about today is low-level alcohol equally bad? Can we justify somebody consuming low-level alcohol? First of all, can we define what is low-level alcohol? And can we justify consumption of low-level alcohol in certain age subset, in certain population, and whatnot? That's what we are trying to address here. We all categorically understand that regular consumption of alcohol, particularly in moderate to high intensity, is bad. There is no discussion about it. So for the sake of today's discussion, I will be taking the side of supporting a low-level alcohol, just so that I can keep the balance on. So I will start my discussion with taking opinion from Praneeth. And because this is not a case discussion, I would like each one of you to share your thought about what you think with regards to the statement that WHO published. What is your personal thoughts about this in pro or cons ways? Either way, it really doesn't matter. So Praneeth, I'll start with you. This is the statement that came. You can take any scenario. Let's say a patient comes to your room, or you are having dinner with your friends and family, or one of your family member asks you this, that, hey, what is going on? Because now it seems like alcohol is probably as worse as smoking. So tell me, what is your thought on it? How do you take over? And maybe I will cross-question some of your thought process as you mentioned, so we can have a little bit of rebuttal between both of us before I go on to my attendees. Praneeth.
Sure. So the common situation which at least I encounter is with patients where they ask you about alcohol consumption. So doc, can I take some alcohol once in a while, something like an occasion, and what do you advise? So this is something like where they want to take alcohol with the consent or with the recommendations of the treating physician is what they say, and it is a very uncomfortable situation or an uncomfortable question for me to answer, because I understand that alcohol is something like a more of a habit, and habits can't be changed all of a sudden. I would try to look this, or I would help the patients, or I answer this question by asking them how much they consume, and then ask them to try to reduce it, and then gradually reduce it over a period of time. Getting back to the point of discussion, the alcohol has been contributed to so many diseases, and now, as we know, the WHO reports says that there are so many diseases from top to bottom which are contributed to or attributed to the consumption of alcohol. And the debate that we were having, or the understanding that we are having, is depending on the amount of alcohol, frequency of alcohol consumption, and more importantly, the so-called amount of alcohol that you are taking per occasion. So these were the one which were said to be the most important risk factors for the development of be it cardiovascular diseases, the cirrhosis of liver, etc. But now, as we know, that this is not true anymore, and any amount of alcohol is said to be kind of harmful. The problem is that how do you define the so-called amount of alcohol that you consume? We all agree that the amount and frequency of alcohol is definitely harmful. And to kind of answer that question, the whole concept of standard drinks have been brought into picture. But again, there is a lot of variation. Sex differences are definitely there, women being more susceptible than men. But as we know, the information is increasing, alcohol is probably more harmful than beneficial. It is not helping the person. It is only increasing the harm. If it had been neutral, I would be probably at least okay, where for some time I would have allowed. But as the data is more and more in favor of causing more harmful effects, not even being neutral, I would kind of will be switching gears now, and will be strongly recommending everybody in my surrounding or my patients to kind of abstain from alcohol and try to cut it down totally. So, because the evidence seems to be a bit more strong in suggesting the same. Anoop.
So Praneeth, here's my question to you. Okay, and if anybody in the attendees have any strong rebuttal against what I'm saying, please feel free to raise your hand or interrupt me. So what the overall registry or the observation, what is brought up, that there are excess of cancer death in people or in folks who are consuming low dose or low amount of alcohol. And if we cut down that alcohol, then we will be able to reduce those mortality. Now, those numbers are fairly low, and for obvious reasons, because we know that we are talking about low level of consumption. So the overall risk that we are talking about is very low. Having said that, and how low we are talking about, so year 2017, WHO estimates that in the entire Europe, 23,000 deaths can be attributed to low level of alcohol consumption. 23,000 deaths, cancer-related deaths, can be attributed to alcohol. So if you get rid of alcohol, correct, 23,000 deaths in the year of 2017 would have been prevented. But that 2017 we are talking about in the entire Europe. We can look at the overall numbers. We can look at how many deaths prevented per given population, whatnot. But here's my question to you. Let's talk about traffic accidents. So if you don't get out of your home, you won't have a traffic accident. Versus if you take your car and go to work, then the more number of hours you spend on the road, higher is the chance of meeting with an accident. So one can argue that if you make people work from home the entire time, or if you make people stop going to work in India, you will reduce the traffic related accident by, God knows, 70%, 80%, 90%. Because traffic related accident, while it is very low, the incidence is not zero. Now, can we stop people from going to work? And I would like to know your thought process about which one is more important. Because I can tell you there are so many reasons why low level alcohol in a society. Now, one can talk about why society grew that much, but there is a long history behind it. I can't change that history. If you think that going to work is that important, I can at least give you some reasonable ground that why alcohol also acts as a social bond, and we are social animals. So do you think we can execute this where we make people stop going to work, and that way we reduce traffic accidents?
Right. So the whole point of this is like the excuse that is being given to defend the consumption of alcohol. If the whole point of taking alcohol is of question, now if we have to socialize, then there are ways to get socialized, and alcohol may not be the whole reason of uh, socializing. These are how some of the habits that we develop, where we start associating the habit of socializing with probably alcohol. Now alcohol becomes the part of the habit of socializing, but it may not be the same. That the whole act of socializing may not always be associated with alcoholism, and we can still get socialized without any other reason, just because it is a long habit that has been developed, and because it is associated with frequent usage of alcohol in any form. Now it has become almost like a new norm that if you have to socialize, then you have to consume alcohol, and without alcohol there is no socializing. So that is the kind of an excuse that is being brought up, but I don't think that that should be the reason for it. As I say, anything that if it had been at least neutral, still it would have been okay. Where until this point, the whole thought process that if you can limit your consumption of alcohol, like avoid taking binges and also avoid frequent consumption of alcohol, until that point of time this was still okay. But now that we are knowing that even low levels are okay, these habits that we have developed, or this thought process that has stuck to our mind, probably has to be changed.
Okay, so let us work on your premise that you have mentioned. All right, so this is a habit we have developed, this is an excuse we are taking. Now since we know it is bad, why not change it? Well, you have to agree that you can't just push a button and you can change it, right? That is just not possible. Just like before COVID, a lot of the world thought work from home is just not possible. Now after COVID, we know that at least 25% of IT businesses are never going to go back to office. So does that mean that a lot of the work that we are actually making people come to office, we are actually putting those people at risk of traffic accidents? Maybe do we need one more COVID to kind of give more insight to say, no, we should keep them at home only, that will reduce traffic accident, that will reduce pollution and whatnot. But my point is the second one. If you start telling your friends and family or your patients from now on that, hey, listen, we have got this new idea from WHO that now we should stop consuming alcohol altogether. Well, we have not changed the social structure immediately, right? Hopefully it will change over 2-3 generations, but immediately we have not changed. And when we do, when we stop people engaging in this kind of behavior, I can reasonably say that at least a certain portion of them will not be able to engage in the kind of social structure that we are currently a part of. And it is possible that a lot of them will start developing mental illnesses or depression or whatnot, just like what happened with COVID, where we kept people locked up in the room. So when we talk about the incremental benefit that we are going to get by stopping people from drinking low level of alcohol at the price of adding more psychiatric or psychological illnesses in the society, do you think that is a trade which is worth for us to take?
I'll probably try to compare this with smoking. And now there is enough evidence now that we say, or at least from everybody, be it health professionals or common public, if you say that smoking is injurious or harmful, or tobacco consumption in any form is harmful, but still those things haven't changed. And smoking is also kind of get started by these socializing activities, where because of peer pressure or because of the circumstances, these new habits have developed. Yes, change is something which does not happen overnight, but if the thought process is, if we understand and agree that this is something which is true and which is going to be harmful on a long run, then probably it should start. We know that smoking, though, has enough literature. Smoking is still widely prevalent, and there are companies which do survive on selling tobacco and related products. And no government or any organization could not put a strict ban on these products because the entire revenue system or finances work on these things. So similarly, alcoholism or alcohol related issues probably work on the same principle. But at least as a health professional, we should at least take a stand on saying that yes, this is what it is. It is no more. We can't be disguised or we can't be fooled around saying that no alcohol in low consumption is actually helpful, because this is what is the again excuse which most of the patients give, that alcohol taken in small quantities is in fact helpful, quoting the European or the French colleagues that they are healthy and they live longer because they consume wine. And hence I am taking it, red wine being a popular drug, saying that this is actually making me feel healthy and I want to consume it. That thought process needs to be changed, and at least yes, you are taking it, understand that it is associated with risk and it's a choice. And let us not fool around and say that yes, this is actually harmful or this is neutral. Yes, it is harmful and you should be understandable. And maybe if I think that as the pictures come where there is picture of smoking being injurious to health, maybe sometime we may also see that in on the alcohol bottles, we probably that may be the future ahead.
Praneeth, what I am trying to address is that when we talk about removing low-level alcohol from society, we are talking about a gradual change which will make things better and whatnot. I am actually trying to propose that it is going to backfire. And the reason why it is going to backfire is that when we take these things away from society, then what is acting as a cohesive bond amongst various people, now we have to look for something else as a cohesive bond. That something else as a cohesive bond, God knows what that something else is going to be. And I will give one more scenario before I open this discussion, because I just wanted to kind of engage a discussion with Praneeth for a few minutes so that I get the stage set for others to give a comment. So a random person, a random Joe who is walking around on the street, let's say somebody who consumes low-level alcohol. I'm just giving an example. A random person eats rice, consumes more sugar than what he or she is supposed to, consumes more salt than what he or she is supposed to, consumes more calorie than what he or she consumes to, does not do as much exercise as what he or she consumes to, maybe smokes cigarettes, that part is not very common, but it's still there, and various other things. So, and of course, he's living in a world where he's exposed to pollution and there is a lot of stress in life and whatnot and all of that. When I have to engage in any kind of lifestyle related discussion with that particular person, I do not find that removing low level alcohol will even reach my top 10 when I'm talking to that person. Now, if I find a person who has taken care of his simple carbohydrates from diet, which we know is very bad, who has taken care of smoking from his life, which we know is very bad, who limits the amount of sugar, who limits the amount of salt, who is exercising daily, and the only thing which is remaining now is that he or she is consuming low level of alcohol. So I can tell them that, you are one step away from nirvana, so go and stop consuming alcohol also, and you'll be absolutely fine. But in a random person that I'm meeting, there are so many things that we can make our life better with. And I think stopping that low level alcohol comes very, very late in how I discuss it. So anyway, I have at least put up my thought process behind it. My colleague Praneeth, he gave the antagonizing view about it. I would go down the list of my attendees and I will take opinion from each one of them. So I'm going to ask each one of you about your opinion. So please be ready. Srinivas Raju sir, if you could please unmute yourself You don't need to give a disclaimer whether you consume alcohol or not, but you can give us your thought about. You can give us your thought about what you think.
Right. We are pretty much strict with our patients. Like we tell them a target of blood pressure 130, 80, stop smoking, and then consume less amount of carbohydrates. And if they have cholesterol, all the food what they are supposed to avoid. And now, if we say like absolutely zero alcohol, when some of us do consume, I think it's quite difficult to practice. I think we'll lose our practice. That's my take on this.
That
It's
is about
difficult for
practice.
patients to believe that they need to stop alcohol too.
Now that is about practice, but how about, let's say you are sitting at home on a dinner table with, let's say 10, 15 of your friends and family. What do you tell them there?
If the evidence says it's strongly in favor of stopping, I think you should go by that. But as you said, there are several other things, not just alcohol, which is responsible. It's all a cumulative risk. If they have already taken care of most of the things, probably you can still do away with one or two habits like this. But yes, if he's taking a lot of alcohol, certainly he needs to stop it. But now evidence says it's no alcohol at all, so we will go with this.
So last question to you. Next time when you hold a party or a gathering in your friends and family, will that be a dry party, or you will continue with the so-called societal norms?
That depends who my friends are. If it is you, it is going to be with alcohol. If it is relatives, it's going to be without alcohol. Yeah.
Thank you so much. Thank you so much, Srinivas sir. Shankar sir, your thought process on today's discussion.
Good evening to all. There is a good discussion is going on, but I am a teetotaler. I say no to alcohol to everybody because we have to change the mindset of the people because of the toxic effects of alcohol, as WHO also mentioned the same. So regarding this alcoholic consumption, see, many guidelines from different countries, they advise moderate drink at a low level of alcohol because of low risk. That is not more than 2 standard drinks per day for males and 1 per day for non-pregnant females. So what is standard in? This is already discussed, but about 14 grams of pure alcohol, that is about 18 ml pure alcohol. So the types of beverages, like if it is equivalent to that 18 ml of pure alcohol is 250 ml of malt liquor, 150 ml of table wine, and 100 ml of fortified wine, that is a port wine, 45 ml of brandy, and 45 ml of this 80 profit spirits, 80 proof spirits, gin, vodka, whiskey, and all. That is up to 45 ml, one standard drink. The 350 ml of beer. So these are all standard drinks. So the moderate drink, as I already mentioned, two standard drinks for men and 1 standard drink for female, or 14 7 per week for females and 14 for males per week. This is regarding what is standard drink, because this definition of a standard drink varies from country to country. It may not be same in the USA and the UK and Japan or India, but the guidelines say that this is the standard drink, 14 grams of pure alcohol. Because this alcohol consumption it is associated with many medical comorbidities, as everybody knows about it. There is a increased cancer risk is there, gastrointestinal, esophageal, and gastric, and head and neck cancers also increased. Breast cancer also is related to the alcohol consumption, and cirrhosis, pancreatitis, osteoporosis, the hematological complications, gout, the heart failure, especially when the neurological complications, these are all associated with this alcoholic consumption. Not only apart from esophagitis, gastritis, but the other violence, as already alluded to, is violence, the suicidal tendencies, the accidents, the trauma are all related to this alcoholic consumption. That's why I say no to alcohol. At the end, I will give my thought process. But why moderate drink is helpful in cardiovascular protection? So in some studies, it is still uncertain, but few studies, they moderate alcohol consumption within guideline limits has been associated with decreased mortality and may have cardiovascular benefits through various mechanisms like antioxidant effects, enhances insulin sensitivity, antithrombotic effects, anti-inflammatory effects, increases the HDL levels, increases the serum apolipoprotein A1, and decreases the plasma fibrinogen concentration, increases the tissue plasminogen activator. These are all mechanisms mentioned where the low levels of alcohol gives some cardiovascular protection. But what about other systems? So it may protect, it may have some protective role in cardiovascular system, but what about the other systems? So there is a increased incidence of cancers is there even with the low consumption of alcohol. So ultimately, what I suggest is that individuals who are not currently drinking, or those who have personal preference to avoid alcohol, they should not be advised to consume alcohol solely for the purpose of CVD risk protection. So this is my take-home point. And already those who are already associated with the comorbid conditions, they should abstain from alcohol. But regarding this so high economical status and socializing, all these things, where it has become a customary, then the midway between high and low, the patients who choose to drink moderate amounts of alcohol, less than one drink, less than one standard drink per day, or less than 7 drinks per week, sometimes they may experience benefits regarding their health. This is observed. That's why via media, I am a teetotaler, but those who incline to take little amounts of alcohol for their beneficial effects of health, they can consume less than a drink, less than a standard drink, or less than 7 drinks per week. This is the final comment on the alcohol consumption. But as a healthcare provider, we should say no to alcohol, and we should bring about public awareness regarding the toxic effects or side effects of adverse effects of this alcohol consumption. Thank you, one and all.
Sir, I have a question for you. The numbers that you put up about the low level alcohol, are you aware of any authority data or any authority guideline from India who have mentioned that what Indians should do, because most of these numbers, they come from either US or Europe or Australia. And we know there is a lot of ethnic variation in terms of how much alcohol was so far considered within safe limits, which is what we are questioning right now. But do you know of any guidelines that Indian authorities have ever released?
To be frank, I don't know anything about this alcohol, spirits or alcohol. The one doctor, I don't remember his name, is a gastroenterologist. In every conference of gastroenterology, he details in a very good manner regarding alcohol, the percentage of alcohol in each liquor, malt, whiskey, and brandy, and what are these? I don't know, but he explains, and ultimately he advises to take moderate amounts of alcohol. A gastroenterologist. I don't
Thank you
have
so
any.
Sure.
I don't have any idea regarding Indian data. This is what the UK and US guidelines have given.
Right. Thank you, sir. Because the reason why I asked you this question is because there is a very, very significant difference in terms of what is considered low level for individual scenarios. To give you a sense, the country Belgium talks about 21 drinks a week to be safe for men. 21 drinks would mean 3 drinks per day. Now that would be much, much higher than what we typically talk about 1 drink per day. Australian guidelines, they recommend that we should not advocate more than, in fact, we should not advocate any, but if we have to give so-called a permissive consumption, then Australia recommends no more than 10 drinks per week. So there itself, you see, there is a vast difference where the region of Australia mentions 10 versus Belgium, part of the Europe, mentions 21. You quoted US, which mentions 14 drinks for men and 7 for women. So a lot of these regional variations are there. And this is what WHO was actually challenging, saying that forget regional variation, forget age variation. We should actually just say clearly stop, zero. That's pretty much what the WHO would say. I will go ahead and invite others to give their thought, and I'm just going to read out the name. Dr. Kanika is here with us. Dr. Kanika, if you have anything to share with us regarding this topic, could you please unmute yourself and share your thoughts? Okay, if not Dr. Kanika, the next I have on list, Dr. Sheila, if you are able to hear me, could you please unmute yourself and share your thoughts about today's topic? Okay, we will go down the list. Salma, what do you suggest to your patients? I know you deal with a lot of transplant and heart failure patients. What is your thought that you share with your patients?
Very good evening, sir. There are, as you said, I was hearing to Shankar sir and others saying that, it is basically a habitual thing, as Praneeth sir also said. So one question I tell all my patients usually is, like, if they say, they get peace of mind, they get that relaxation, or we have to meet friends, and then, we have to have it to maintain that company. I tell them the same thing, that rather than having alcohol, why don't you encourage some good habits, like, discuss about some exercise, discuss about some therapies that they have helped, or early reaching. So basically gathering can be made by any source, or the means of gathering can be anything. So rather than having the harmful thing which can cause a detrimental effect on their health, we can actually encourage, as Shankar sir was saying, some communal change where somebody has to take that first step. Though it is difficult, it is not easy, but yes, I strongly believe that one day people will really realize that this is something is wrong, because as I say, poison is a poison in any form or in any measure. So this is what generally I tell my patients, and I have actually witnessed people who have come out of alcohol, so severe alcoholism, just because they had to take that decision that yes, this is, and accept that this is not something which is going to help them in wrong run.
Thank you, Salma. Point well taken. In fact, sometimes when this is not just hypothesis, we have a lot of examples where when we try to replace one bad thing, not bad thing as in heavy alcohol. Remember, we are not talking about heavy alcohol. We are only limiting ourselves to low-level alcohol consumption. So when we try to replace sometimes a really bad thing with something which we presume it to be good, there are enough examples in recent history where rather than gaining that 0.1% or 0.2% benefit, it actually backfires to a degree where we start causing more harm. In the very recent decade or so, you can take example of smoking, where when the anti-smoking campaign was going on, now remember this anti-smoking campaign started in 1960s, and it gained significant momentum to the degree that now the overall incidence of smoking, at least in developed and to a certain degree developing countries, have gone down quite significantly as compared to what it was in 1960s and 70s. So, but lately in the last 10 years, to bring down the rates of smoking even further, this whole vaping and e-cigarette and whatnot came around with the idea that they are going to actually reduce the risk, only to later realize that vaping-induced injuries were actually causing a lot of harm. Now, whether the incremental harm was higher or lower than the low-level smoking, I don't think there is any statistical data about it. The same thing that came around with sugar, where we started talking about, okay, so high sugar consumption is bad, but how about if we replace even little bit of sugar consumption with the sugar substitutes, like for example, aspartame and whatnot. And then there was cumulative evidence that was coming around saying how sugar substitutes are also bad. So you should probably just completely stop sugar altogether. So replacing alcohol with what? We don't know. If alcohol is replaced by nothing and just a casual chit chat and sharing good things about each other, then that's probably good. But my fear is that if we start replacing this low-level alcohol with something else, that something else will probably have some degree of incremental harm, if that something else is not just sitting idle and chatting about our life and whatnot. So that is the whole that is the whole fear, that is the whole concern that society may have if we start telling them that no, you need to get rid of low-level alcohol also. Anybody else has got any other thoughts regarding it? And I must put this disclaimer that I'm talking on purpose, favoring low-level alcohol, because I could get a sense that most of the audience will be talking against it, just so that I can have the balance going on. If nobody has any other thoughts, I will like to engage in this discussion with Somaraju sir a little bit. Somaraju sir, if you could please share your thought about today's topic and if we are getting it wrong somewhere.
Thank you, Anoop, Praneeth, and all of you. It's a very interesting topic, but it's still relevant. It's made more relevant, particularly because the WHO comes out with a study. I just want to ask you, when the 2,300 people died, what are the subsets in the age groups?
So, sir, they said 23,000 in excess deaths. They did not.
You mean the age groups who died because of alcohol?
Yeah, so in that particular number which they quoted, they did not mention the age group, that particular. But
when they didn't mention age groups, I have serious issues related to so-called evidence-based medicine we practice. It has serious problems, including so-called randomized clinical studies, the way we interpret them, the way we mislead ourselves and the public around and professionals around is a common problem now. If those details are not available, this study is not to be quoted at all. We know WHO, how it dealt with COVID information to begin with. And just because WHO don't go by it alone, I would say, when I say this, I am not saying that alcohol is good or bad, but don't go by a study which is very inadequate, incomplete, and not full of details requirements. If you look at people who died beyond 60s, for example, they already lived 60 years. And then even without any other specific factor, people beyond 60s, 1 in 3 males, 1 in 5 females will have cancer. Those issues have to be kept in mind while we interpret these studies. Then the other issue is how do you explain French paradox? Then when you say I won't go into excessive details except telling you we need to look into it in more detail, particularly this. I wish you gave some details about the study why before we go on talking about this. If it is not done today, do it next time. We need to analyze it carefully. And then the other issue I want to tell you is humans as we are, there is evidence from other studies available, not only about alcohol, other so-called psychotropic drugs. Not all of them are found to be bad. They had positive influence. But at the same time, it varies from individual to individual, circumstance to circumstance. And then when you say, I think you pointed out how different societies and different races handle alcohol differently. The Westerners, how they handle alcohol is different from the Asian communities. That has to be kept in mind also. Then I firmly believe alcohol in moderation is not harmful, but at the same time, I have no evidence, but I am not going to be just taken away by this WHO type of study unless all the details are available to us, which is difficult to get. I have serious doubts about the evidence base they draw conclusions. Finally, I must tell you, each one of us, we are not ourselves. In a society we live, in the complexities we live, average human being is not himself or herself. We are slightly better off when we are under the effect of some amount of alcohol. At least when we sit with people, when we sit socialize, we come out better people at that time. And finally, I must add, some of the best decisions I made in life, I made when I was under, say, moderate influence of alcohol, including leaving care. Thank you.
Sir, I will continue where you left, and I would like your further comments on this. So I'll tell few of the things that you have mentioned. So French paradox is something that I sincerely believe we all, at least to my attendees, at least spend some time reading about it. It's a very rational theory that one should try to understand. It's an unresolved puzzle, I would say, not a mystery, but a puzzle, I would say. Similar thing that we talk about Japanese also, where we talk.
Sorry for interrupting you.
Yes, sir. Yes, sir.
Okay, whatever clinical experience I have in the last 45, 50 years, some of the worst smokers we saw, and when we evaluated them for coronary artery disease, including angiogram, and they were also, when they were also alcoholics, their coronaries were most often normal. Thank you.
Right. So I was talking about the Japanese population also, where you know that they have the highest longevity and very low incidence of coronary artery disease on a relative scale. But as you know, the incidence of smoking is one of the highest in that area. So a lot of these community-specific models which are there, which again, we have not created that model that has been there. French wine drinking and whatnot that have been there for quite some time. This is not something that world has modeled into. That is how it has been, and it provides us a good background for epidemiological study. Sumaraju sir, to defend myself, the reason why I did not dig too much deep into that particular data that WHO was quoting was because these are population-based data set, and while they do have the age differentiation in their main paper, which I did not read, I did not want to take too much out of it just because I knew that these are population-based gathering. They are typically done under some registry, either a death registry or a cancer registry. They are inherently flawed. They just talk about basic numbers, but that is the best thing that we have got. It can't get better. The data set cannot get better than that because we can't do a randomization on it. But I do want to bring something, and I'm not favoring what WHO said. I'm just talking about the thought process behind it. I learned these two abbreviations, which I did not know before this. As I was reading through alcohol, I learned these two abbreviations. One is called TMREL, which stands for theoretical minimum risk exposure level. And I want to emphasize on each of these words. It's a theoretical minimum risk exposure level, TMREL. And they use it for anything. They use it for any exposure entity, be it alcohol, be it smoking, be it pollution, be it whatnot, where they try to see what is the minimum risk exposure level for that particular entity, which renders any risk to that individual or to that community, and compare it with their non-exposure equivalent. In this particular case, non-drinking equivalent. So when they compared, at least what the WHO reports, when they compared this theoretical minimum risk exposure level to non-drinkers equivalent in the age group of 15 to 39 years, the equivalence was close to zero. How they went to this methodology, I don't know. But this is what they are reporting, publishing on Lancet, that their TMREL, when compared with non-drinkers in age group of 15 to 39, is close to zero, which essentially means that abstinence is the best modality for this age group as well. I'm just a messenger. This is what WHO is mentioning. I'm sure that these data set, they are acquired with a lot of assumptions, with a lot of theories in behind. We can take it at its face value, but at the same time, we have got examples like French, examples like Japanese, for which also we don't have very good idea. I do take your thought with great deal of respect that we as a human being are not individuals, we are part of our society, and many of the times we do need to engage in things which keeps us together. And as you said, that sometimes some of the decisions that we take when we are not completely sober. So Somaraju sir, would you change your thought process?
Anoop, I just
Yes, sir.
wanted as some of you, when you have time, just go through how difficult it is to do a population study and a groups of people. One of the examples is the nurses' health study in Harvard. How misinterpretations were done, how the two groups over a period of time, people didn't follow the advice. So-called randomization was not real randomization, because even the ones who were not supposed to be following what they were following, they changed their health habits over a period of time that was not considered in the study. So how studies can be misinterpreted is a daily experience today. It's very common now. So when you do a population study with multiple issues, dealing with human beings of variety of kinds, you have to be very careful. But at the same time, while we question the so-called evidence-based WHO came out, we should still notice it and look into it carefully, and also be open-minded. Thank you.
Thank you so much, Somaraju sir. And this was a topic which was kind of slightly different than what we typically do on the huddle discussion. But I hope we were able to at least share some of the thoughts together. If anybody has got any final comments, we'll take. Otherwise, we would close the session. Okay, if no further comments, then Praneeth, you can close the session for today.
Yeah, no. So I think an interesting discussion, and I think this is definitely something which I would say a bit controversial and also sensitive. But as sir was saying, yes, currently the evidence or the research that we are getting, or the so-called evidence-based medicine that we are getting, based on the recent experiences, we should be a bit aware of that there can be some problems with the data interpretation and the way the results are interpreted. And we should not just go by the face of it. Use your discretion to analyze the data yourself and make a thought process. Something which is a radical statement probably needs more thought of it. Something like this one, which kind of touches everybody. And ultimately, anything in moderation, be it in terms of alcohol, sugar, energy, carbohydrate, whatever, moderation is always key. So as long as we use the logic and common sense, anything in moderation should be okay, and probably that is what we should stick to it in respect to anything. So probably that should be the goal, and defining this moderation is something which is key, and I think that is where will be the challenge. And hopefully, if we can have some Indian guidelines, that should probably help us understand and make a decision better. That is all that I can have for discussion.
Dr. Praneeth and
Sir.
Anoop, just wanted to just add, there is a often quoted Frederick Nietzsche saying that what doesn't kill you will make you stronger. That is the basis of vaccination. I think alcohol in moderation is vaccination.
So, sir, you mentioned this. I actually was, there is actually a technical term. I was just about to share that. I won't go into the details of it, but to all the attendees, if you have time, just Google and search this word called hormesis. Hormesis is spelled as Hormesis. And this hormesis actually it's just incidental. I was about to say this, and then Somaraju sir mentioned this. The basic essence of hormesis is what sir said, that what doesn't kill you make you stronger. The idea here is, and I'll just give you a premise and I'll let you do the search for yourself. The idea here is anything that is toxic to you, anything which is injurious to you, if you use it at a very, very low dose, if you expose yourself to a very, very low dose, then for some reason it has got a positive effect in your body. Whether vaccination can be considered a part of hormesis or not, I'm not quite sure. But there is very good, I wouldn't say data, but there is very good theory about radiation hormesis, where the idea here is a very tiny bit of radiation exposure actually makes your health better. And that so-called J curve, that after a certain point, it actually makes it worse. But early on, there may be a little bit of benefit. Whether alcohol has hormesis or not, there has never been a data about it. And so are any other toxins that we have it in daily practice. But the common way of saying it is what doesn't kill you make you stronger. If it applies on alcohol, I don't particularly know, but it will be a good trivia thing for you to read on a weekend when you are sitting idle and have nothing else to do. So the word is hormesis, Hormesis. With this, I would thank each one of you for participating today and sharing your thoughts. We will be back next Wednesday with a new topic. Thank you all. Good night and take care.